Hello, my name is Donna Edwards, and welcome to Addiction Counselor CEU. Today we're going to be discussing behavioral health services for people who are homeless. Ending homelessness is an important public health service in the United States. Many experiencing homelessness have high rates of chronic and co-occurring health conditions, mental and substance use disorders. Individuals who are homeless also may be dealing with trauma, and children experiencing homelessness are at risk for emotional and behavioral problems. Additionally, research has shown that individuals who are homeless have a risk of mortality that is 1.5 to 11.5 times greater than the general population. Preventive services, including mental health, substance use, medical care, and social supports, are needed for people who are homeless, irrespective of whether they present with diagnosable conditions. According to the data collected as part of a 2015 AHAR, over half adults living in permanent supportive housing either had a mental disorder or co-occurring mental and substance use disorder. Further, people experiencing homelessness are at high risk of overdose from illicit drug use. To further compound these already significant problems, data shows that adults aged 65 and older who are homeless also have a higher prevalence of unmet needs for substance use and mental disorder treatment compared with their other adult counterparts. Providing housing to people experiencing homelessness can help prevent and extravate the substance use and mental disorders. However, separate treatments and housing considerations must be accounted for when working with this population. Here are some key messages. People who are homeless are at elevated risk for experiencing substance use disorders, mental disorders, trauma, medical conditions, employment challenges, and incarceration. People experiencing homelessness present unique treatment challenges, as both treatments and housing needs must be concurrently addressed for treatment to be most effective. Preventative services for people experiencing homelessness, including mental health, substance use, medical care, and social supports, are critical for mitigating risk of SUDs and mental disorders and improving health outcomes. Treatments providers must be knowledgeable about and help clients identify available housing resources. Person-centered prevention and trauma-informed treatment practices are essential when working with people experiencing homelessness and help prioritize and address complex issues that clients face. Providers should work with federal, state, and community-based agencies to secure permanent supportive housing placements for their clients. Clinicians must know how to help individuals access federal or local benefits to improve housing stability. Poverty and high housing costs that exclude individuals from local housing markets. The removal of institutional supports for individuals with SUDs and decreased job options for individuals with only a high school education are just some of the environmental factors identified and contributing to homelessness. Individuals' contributes that increase the likelihood of experiencing homelessness include cognitive problems are more prevalent among people who are homeless and individuals with SUDs compared to those who are housed. Preventative services for people who are homeless. Preventative services may include medical care, housing supports, and other social and supportive services. Example given: employment, educational supports for children. These services help a client work towards housing stability and support retention in substance use and mental health treatments and long-term recovery. Preventative services can be categorized as universal, which is targeting the entire population, such as a community, state, or country. Selective, which is targeting subsets of the population considered at risk. Indicated, which is targeting and delivered to individuals exhibiting early signs of problem behavior. Preventative services are often provided in clinical settings such as primary care, hospitals, or counseling centers. They include life skills development, stress and anger management, anticipatory guidance, parenting programs, and screening and early intervention. These programs may be designed to directly prevent substance use and or promote mental health and may strengthen individuals and families and enrich quality of life and build resiliency. Providing housing and other preventative services to people experiencing homelessness can prevent the exacerbation of substance use and mental disorders or transition from normal functioning to the first phase of the problem development. Screening and evaluation. In general, the first steps in providing preventative services to an individual experiencing homelessness involves initial observations and decisions about care. It is important to determine if the client is in imminent danger to health or safety and requires imminent help. Providers should collect primary care records and information on the following: substance use and SUD, mental disorders, effects of specific symptoms, co-occurring disorders, and exposure to trauma. They should also evaluate the onset of homelessness, currently available to maintain stable housing, and the criminal justice involvement. Client retention and continuity of care is a significant challenge to address among individuals experiencing homelessness. For those living with chronic homelessness, the task of addressing health care, financial needs, criminal justice issues, and housing security is daunting. Therefore, client retention requires the development of short-term, realistic treatments and prevention goals. Goals should be set collaboratively with clients to include specific milestones within a defined time period and rewards. Contingency management to increase retention. severity of their illness and the client's readiness to change. For clients with SUVs, 3 housing types are utilized based on the individual's readiness to change. Wet housing permits the use of legal substances and is suited for pre-contemplation or contemplation stages and includes engagements in treatment services. Damp housing meets the basic needs of a safe shelter and increases the client's readiness to accept services. It is suited for contemplation and pre-contemplation stages. And the sober housing, which includes a group of housing options and is best suited for clients in the actions or maintenance stage of change. Permanent supportive housing is a housing placement and supports model widely used for individuals experiencing homelessness who have an SMI or other disability. It provides additional supports as needed to help individuals live stably in the community. This type of housing offers a combination of housing and services and is an established solution for clients experiencing chronic homelessness. The ultimate goals of permanent supportive housing models are to offer housing choices, de-emphasize institutional care, prevent relapse, and reduce discrimination and stigma of people with mental and substance use disorders. Permanent supportive housing evidence-based practice EBP Kit lists 12 elements of permanent supportive housing programs that form the 4 guiding principles of these programs and differentiate them from other forms of housing assistance. So the first one is the leases are in the tenant's name and provide full rights, including protection from eviction. Second, the lease has the same provisions held by people without psychiatric disabilities. Third, participation in services is voluntary and refusal does not result in eviction. Fourth, if there are house rules there are similar to those for people without psychiatric disabilities. Number 5, there is no time limit on housing with a renewable lease. Tenants are offered a range of housing choices that would be available to others at the same income level. Housing is affordable no more than 30% of the tenant's income. Housing is integrated, allowing the opportunity for tenants to interact with neighbors. Tenants are given choices in support services they are provided. Support services are dynamic and can change as needs change over time. Support services are focused on recovery to help tenants choose, obtain, and keep housing. Housing and support services are delivered separately. Recovery housing is an intervention that addresses a recovering individual's need for safe housing while providing the requisite recovery and peer support. In 2018, the Support Act was passed, which requires the development of best practices for the operation of recovery housing. The resulting report includes 10 guideline principles, having a clear operational definition that delineates the types and intensity of services provided. Recognize that SUDs are a chronic condition that require a range of recovery supports. Recognize that co-occurring mental disorders often accompany SUDs. Assess applicants the potential Addressing the needs of special populations. Some groups experience homelessness at higher rates than the general population and may need to be considered differently when receiving homeless services. Veterans are at increased risk for experiencing homelessness, but are also eligible for additional programs offered by the Department of Veteran Affairs, the VA. While it is often assumed that single adults in urban areas are the most common populations experiencing homelessness, families in rural populations are also at risk and often need but may not have access to mental health, substance use, and homelessness services. Families who are impacted by homelessness face additional challenges that include an increased risk of traumatic experiences and interpersonal difficulties. Special services and resources for families are available, such as family-only shelters and child-specific health care options. The vast majority, which is 98% of homeless families, are sheltered but in need of stable housing. HUD 2020. It is important to treat families as a separate subpopulation with their own specific needs. For additional information and resources regarding family homelessness, please refer to the HUD Exchange for a number of available resources. In the rural populations, available housing and treatment centers can be limited in rural areas. Individuals experiencing homelessness in these areas are typically less visible, so outreach and engagement efforts may require a different approach than efforts deployed by urban areas. The availability of job opportunities, shelter, health services, and social programs are often limited. The National Health Care for the Homeless Council has collected a number of available resources for working with rural homeless populations. Homelessness represents a significant case management challenge for treatment programs and administrators and other family staff members who are responsible for finding housing resources. Some considerations that must be addressed include limited resources for housing people in early recovery from substance use and or mental disorders, time required to find and evaluate potential resources, collaboration efforts involved in working with other community agencies, and limited funding available for housing services. In addition to addressing these considerations, administrators and treatment providers will need to ensure that individuals who are homeless are able to participate and remain engaged in ongoing services and care. They will need to work with clients to manage transportation, mental health, SUD, health care, financial, criminal justice, and employment issues complicated by homelessness. However, the reality is that an individual who is homeless is in crisis and has immediate housing needs that must be addressed in a limited period of time. For more information on the use of effective case management strategies in working with clients with SUDs, please refer to SAMHSA's Tip 27, Comprehensive Case Management for Substance Use Treatment. Intra-organizational needs assessment. To determine the treatment organization's ability to assist clients experiencing homelessness, a number of initial questions must be addressed. An intra-organizational needs assessment is a process that includes staff and stakeholder discussions at an organizational level to better understand the program's ability to assist this special population. Key steps in this process include evaluating the basic demographics of the target population. This includes to the gaps identified in the continuum of care. Policies that affect client eligibility for services is an example of a policy that could be changed to better meet clients' needs. Identifying larger community level issues to be addressed. These issues could include legislation that handles homelessness through arrest, lack of affordable housing, and insufficient mental health, substance use, or medical care services in the community. Identifying potential opportunities to partners with other providers in the community. Integrational of substance use and mental disorder treatments with homelessness services. Throughout the continuum of care and services, clients experiencing homelessness will likely engage with multiple care providers. It is important that all programs have shared goals and standards of quality of care, with the understanding that addressing homelessness in the community requires a strategic coordination on the part of all providers. Use of the coordinated and integrated approach to care and service delivery is recommended throughout each phase of rehabilitation from homelessness is described later on. The first phase includes building relationships with individuals with substance use and mental disorders who are also experiencing homelessness. Administrators can assist by establishing collaborations with community organizations, forming interdisciplinary teams, increasing staff availability on site, ensuring proper training of staff, developing outreach tools, and providing funding for practical goods that can be offered to potential clients. Transition to intensive care. After a client agrees to accept care, housing and other services, an administrator can support this phase in several ways. This includes formalizing record-keeping policies, providing tangible benefits, assigning case managers, offering supportive services like employment and financial benefits, ensuring staff are familiar with local community housing resources, and developing protocols from transitional planning. Intensive care and treatment. When an individual engages in a clinic, shelter, outpatient, or residential treatments program, they begin the intensive care phase. In this phase, developing a memorandum of understanding, which is an MOU, with housing resources, providing screening by behavioral health professionals, increasing engagement and retention, and developing strategies to improve treatments compliance are essential steps an administrator can take. Comprehensive health care services are also required in this phase of rehabilitation to meet the criteria for outpatient treatment. Transition to ongoing rehabilitation. This phase occurs gradually and has the highest risk of dropouts or relapse. Building recovery skills, encouraging community involvement, and providing transitional housing until a permanent housing placement is identified are all strategies to utilize in this phase. This includes programs like recovery education centers and mental health treatments that have been successful in supporting recovery to transition out of homelessness. trauma-informed, time-limited treatment intervention that integrates co-occurring disorder treatments, critical time intervention, case management, and peer support programming for homeless, veteran, and justice-involved populations. A number of mission manuals and workbooks are available for providers and administrators to use when working with these populations.